Hello, beautiful mamas, and welcome back to the Balanced Mama Project Radio. Thanks for joining today. I'm Dr. Saiah, and today we're going to dive into something that doesn't nearly get as much attention: the pelvic floor. So, what I will say to that point, you may see it more on social media now. Um, Pelvic floor rehab. I've seen so many Kegel exercises come up, and I've had multiple patients come in asking about which one's the best one, how to use them, and runs the gamut of Q&A. But circling back, yes, we're going to get into talking about those mysterious muscles that folks whisper about, but may not always be explained clearly. And I do joke that if I had $1 for every time a person came in or a person was just casually laughing in conversation, and mentioning that, oh, like I leak when I laugh, or oh, I leak when I sneeze or cough, and haha, it's just normal when you're a mom. And I'm like, no, but I would be a millionaire. But I say this is something that's common, but it's still not something that's normal. And so today we're going to bust some myths and we're going to get through some usable tips to help strengthen the pelvic floor, or at least talk about strengthening the pelvic floor during the postpartum period. And a lot of times when it comes to pregnancy, I'm like, yes, if symptoms are coming up, I will talk to my patients and our clients about strengthening, but also talking about relaxing the pelvic floor for when it's time for the birthing process. So, first things first, what even is the pelvic floor? Imagine a hammock of muscles sitting at the base of your pelvis. Let me see if this pelvis will come up. And so here we have it. If you are listening to me, just imagine a hammock of muscles sitting at the bottom of the pelvis, front, back. And so these muscles, they play a role in supporting the organs above. So imagine they're holding up the bladder, the uterus, the bowels. They are helping to stabilize the pelvis. So they're holding that pelvis together from the bottom, your hip muscles, and your abdominal and your back muscles. So those core muscles hold the pelvis together from the top and the sides. I often tell folks when they come in, hey, if there are concerns with the back, if there are concerns with the hip, then we may also have secondary concerns that come with the pelvic floor, or the pelvic floor might have to work harder. And these muscles also help support the bladder and the bowel, so they help keep in urine, they help keep in stool, and then they also function for sexual appreciation. If you want it said a different way, they help with, or they play a role with intimacy. And so this, or why it's so important during that pregnancy time period and during the birthing process, is these muscles are stretching throughout the pregnancy, and even during the birthing process sometimes they may get injured. But either way, I tell my mamas, whether you've had a cesarean or whether you birthed your child via C-section or whether you birthed your child vaginally, we have to think that even through those months that you were carrying leading up to the birthing process, those muscles were still stretching, just like the abdominal muscles were still stretching. So both groups need time to recover in that postpartum time period. And it's important to know that the body does heal. And so again, no, not the snap back, not the bounce back. It's just the body does recover. You can become stronger. It just takes those intentional steps, and intentional, sometimes some extra guidance to get back that strength and to feel strong. And so when we talk about activating the pelvic floor, a lot of times I will tell people it is just as important to be able to relax the muscles as it is to contract the muscles, because in cases of pelvic pain, in cases where folks are having a harder time relaxing, then the focus becomes, okay, let's relax, let's breathe. Let's not so much focus on the Kegel that everyone calls it, but let's focus on softening. But when we talk about activating the pelvic floor, there are a few different cues that people use. So sometimes I'll tell people to imagine you're trying to stop the flow of urine. And since there's different layers of the pelvic floor, we might be activating one section versus another section a little bit more intentionally. Or imagine you're holding in gas. Sometimes we'll say, imagine that the vagina is sucking up water through a straw. It sounds silly, but the cue does get the point across. And we'll often start to train folks, or when I say we, pelvic PTs might even start to train folks to engage those muscles as folks exhale. So a lot of times if I'm instructing someone, I'll say, sit nice and tall. As you breathe in, keep everything nice and soft. Breathe into those ribs. And as you breathe out, I say blow out the birthday candle, just so we can practice the breath. And then breathing again in through the nose. And as you breathe out, while you're blowing out the birthday candle, I say squeeze like you're holding in urine and gas. And so you might feel a little bit of a squeeze and a lift. It might be a soft one. You might have a pretty notable squeeze and lift. And then just making sure, I often tell people, making sure to be able to fully relax, fully let go of the muscles in between that time period. And so with this being said, I think a lot of times pelvic PTs will get labeled as, well, I have been labeled as a Kegel lady, or people will come into the office and say, oh, I don't know why I'm here. I've done the Kegels and they did not help. But I tell people, being able to control bowel and bladder function, being able to have our organs nice and supported, like oftentimes or many times requires more than just a Kegel. And so, not to say that it can't be an important part of recovery, but it is to say that there's more to recovery oftentimes than pelvic floor contractions. And so, now that we've talked a little bit about the pelvic floor, how to activate it and how to let it go, I do like to let people know sometimes, or what are some common signs of the pelvic floor malfunctioning, or the pelvic floor not being not working at its best function. So I tell people, if you're noticing urine leakage, stool leakage, urgency, frequency, sometimes that feeling of pressure, heaviness, or feeling like items are falling out of you, those might be some key things to tune in, or to at least alert the mind, hey, I might need to go check in with a provider. Other things that can come up: pain with sex, difficulty moving the bowels, or feeling like the stool is cutting off. Those can be some signs of pelvic floor dysfunction. And then when we talk about pelvic floor and core dysfunctions, because we're thinking postpartum, the pelvic floor needs to recover, the core needs to recover as well. Sometimes people will see the belly doming. And so almost, if you had to imagine it or envision it, I tell people, if you were looking down at your belly, and as you look down towards your belly button, you see the belly button rising up, or that whole region rising up like a little mini mountain on the stomach. We do not want to see that with exercise. We don't want to see a valley either. So we say no doming, no dipping. And so that can be a sign of a core, like the core not quite functioning the way we want it to. And then often we say, notice what the body feels like, because hip pain, back pain, even pelvic pain, those can be signs that we need to do a check-in with a provider, get some extra assistance, making sure our core, making sure the pelvic floor, the hips and everything are coming back the way, or returning to their appropriate strength and returning to their appropriate function, especially in that postpartum time period. And some of those symptoms I just mentioned, I mentioned those because when we think about, or I should say, shifting gears for a moment, when we think about returning to activity, returning to fitness in postpartum, it's important to be mindful. What does my body feel like? Do I have any extra bodily symptoms going on that I need to check in about and make sure are addressed before I go back to my high level activities? And I say this because we don't want people hurrying out of, or rushing that postpartum recovery and rushing back into activities, all the while leaking urine, or all the while feeling like the vagina is falling out, or feeling that pressure, heaviness down in the pelvic floor, because hurrying back into activity too soon, or if we're hurrying and we don't have appropriate guidance, but we have some of these symptoms going on, then sometimes those symptoms can intensify. And so I tell people everyone's birthing process is different. And so recovery is going to look different for each person. So, no, it's not necessarily a one size fits all, but there is more research coming out on return to activity, return to fitness, and what that looks like in the postpartum time period. Dr. Aval had mentioned this in one of our master classes before, but it's important to know that that first 0 to 6 weeks in postpartum, though it is a recovery period, I often will tell my moms, and of course, this is not me giving you specific medical advice, but just some general education. I say it is still a good time, yes, to get moving and to gradually start to build up and do a little bit more activity. If the birthing process was more so complicated or traumatic, it might be more of a rest time, because I always tell my mamas when they come in, I'm like, if you're bleeding more, if your pressure isn't regulated, those might be times where we take a step back, do some extra check-ins with the medical provider, because we always want people to be safe returning to activity. But if things are progressing, like we feel, I have some moms come in and they're like, I'm antsy to get back into activity. If they're feeling that way, if there are no red flags that are popping up for them health-wise, then I say, hey, a lot of times breathing, gentle core engagement, gentle pelvic floor engagement can be nice to start to incorporate in those first couple of weeks. So even that 0 to 2 weeks, starting to functionally, and so when you say functionally, when you're going to stand up from sitting down, when you're holding your tiny one, that can be a nice time to just focus on your breathing and to softly engage pelvic floor, softly engage your core. And so I tell you these things not so that you can go out, have to practice them all right away, but I like to make sure that people are not necessarily afraid of movement and exercise. And so even looking at that 2 to 4 weeks, some gentle stretching, and this is if people have time and energy. I like to walk the mamas through and say, if you have time, if you have the energy, and if you were antsy to get active again, some gentle stretching and some low impact light strengthening is often nice to incorporate. So just making sure functionally, oh, am I engaging my butt muscles? Am I engaging my glutes? Am I engaging my core when I'm going on my light walks? It's just a nice time to gradually build up. And so it's not like, oh no, I don't have to do anything at all, but it's a good time for mindful movement and engaging different muscle groups with your movement. And so the last, or I should say that last like 4 to 6 weeks marks, there are even articles that mention doing different types of strength training, typically body weight strength training. Again, keeping it low impact, making sure the body is remembering, oh, I can do these activities, but I can do these strength training movements. I can do gentle exercise without it being scary. And so a lot of times I'll have moms come in and they'll be a little antsy. So I say, hey, you want to gradually ramp up. Walking is a great way to exercise in that early postpartum time period, but not like, oh, I'm going to walk 6 miles immediately after. Everything is a see how the body feels, gradually move further and further. And then I often will mention, just with the pelvic floor and the core recovering, that low impact is typically recommended in that first 12 weeks postpartum, just to give the body time to recover and to reduce the likelihood of those organs coming down. We do not want the organs shifting, falling down. And so, not to say that some people don't get out there earlier and do just fine, but we say for the vast majority, the recommendation is low impact activities. So that just means not necessarily running, not necessarily hopping, skipping, things like that, but this doesn't mean that weight training can't begin in that even thinking about after that 6-week mark. And so we say medical clearance looks different than your actual physical clearance. Like, just because it's time where you say, hey, I've been cleared, it doesn't mean that day we're ready to run. It's like taking time to really regain the strength back. And so I say all of this to say, for initial homework, if you're listening to this and you are an early postpartum mama, next time you're nursing or bottle feeding or even just sitting in the car, take a moment or take 3 rounds of breath of our 360 breathing, when you breathe into the side, into the back, and the front of the rib cage. And so take 3 rounds of breath. With each exhale, we'll either engage the pelvic floor, engage the core, or just soften everything. So for the first one, I say nice big inhale in. And as you blow out the birthday candle, tighten the lower abs toward the spine. And then as you inhale again, keep everything nice and soft. And then as you exhale, tightening the pelvic floor. So squeezing like we're holding in urine or gas, and then softening. And then for this final one, we're going to stay relaxed throughout. Big breath in. And then big exhale. Soften the shoulder, soften the jaw. And you want to make sure that you are breathing through your movements. And so breathing with your sit to stand. Anyways, taking a moment, I hope you notice how the body felt even with doing that gentle activation. It takes less than a minute. And though it takes extra mindfulness to be like, hey, I'm going to intentionally engage these muscle groups, it can start to change the way you feel. And you'd be surprised even over a week being like, okay, I feel my butt engaging more when I go to stand. Or I feel stronger when I'm holding my tiny one because I've practiced engaging my core. And so, thanks for joining me today, listening to a few tidbits about the pelvic floor. And so, remembering just that feeling strong, being confident in the body starts with understanding the body. And then also, if concerns arise, linking up with the appropriate support. So there's pelvic floor PTs, there's OBs, there are various fields that can give some feedback and extra education just on what the normal looks like, or what optimal looks like, and how to be safe in the recovery process. So never hesitate to reach out to your healthcare providers. But I also say, when it comes to understanding your body, taking that moment to be mindful, know how you feel in your own bodies. And so, until next time, stay balanced, mamas.